Hello, everyone, and welcome to our Blade Town Hall Forum. This is our first attempt at this technology, so please bear with us. We hope it goes off without a hitch, but now I've probably jinxed it. A couple items. You'll see on the screen, there is an opportunity for you to leave comments and or questions. We strongly encourage you to put those comments or questions in the chat, and our panelists will respond. In addition to that, if you could note where you're from in terms of the Crow Wing County or general community, as well as what your role is within the community. Are you a parent who has a child experiencing substance use, or are you a member of the sober community, general community member? What's your role in the community? If you could let us know that as well, so we know who our audience is. And we'd like you to complete the survey. There is you can register through handing out, so to speak, tomorrow. Our drawing will be tomorrow morning. So we really need your email address in the survey. We can connect with you if you do indeed win a prize. As I mentioned, welcome to our first virtual community forum, and thank you so much for joining us. Brainerd Lakes Area Drug Education, or BLADE, is a coalition of community working to prevent drug abuse, protect our people, and preserve our community. We're now in a different time with COVID and other social justice issues. And because of the events that we're experiencing, many people are feeling isolation, anxiety, and hopelessness. These experiences can be amplified for those who may be dealing with substance use and sobriety. So we want to connect folks in our community to discuss these experiences and provide resource information for you. We have 4 panelists tonight who will each introduce themselves shortly. They'll provide you with their insight into our current environment and also provide resource information available in our community. First up will be Sheila Clemenson from Essentia Health.
All right, thanks, Kara. Hi, everybody. My name is Sheila Clemenson. I'm a family practice physician, and I work primarily at the Baxter Family Practice Clinic. General practice, kind of diabetes, hypertension, preventative medicine, but I've also worked on incorporating treatment of substance use disorders, or maybe formerly called kind of addiction and care. And like Kara said, in this time of COVID, we are seeing a whole new world of up, downs, and uncertainty. Just in the last few months, I've really recognized how COVID would have changed. Anxiety, depression, PTSD, and substance use disorders have either been worsened or heightened, or even kind of shedding light to them, especially as we have lost jobs or lost insurance. And so I'm super excited to be part of BLADE. We've been working in this group for a while, and so kind of my primary role is to show what we here at Essentia Health are doing and partnering with BLADE, and also with the goals, like Kara said, to prevent substance misuse, protect our people, and preserve our community. And I think most importantly, that's to help through reducing stigma of mental health and addiction, as those two definitely go hand in hand and help to bridge our community together. Thanks.
Hi, I think I'm next. My name is Teresa Reardon. I'm a social worker that works with community services. I actually work in partnership with the Sheriff's Department, so I'm actually located in the jail. It's where my office is at. I work in a program called the Comprehensive Reentry Program, which we started about 2 years ago. There's 2 social workers that work.
People that are well aware of what the risks are. They know that if they got something from, a trusted dealer that they know, but they could have gone through 10 to 100 hands before it got to that person. And just one tiny amount of fentanyl in there, and if they shoot up or use their whatever method they use, that could be it. And that's how strong these with the
outpatient or inpatient are taking individuals. So obviously community services is a good place to start if they want to, if they need a Rule 25, if they contact community services intake department, they'll be pointed in the right direction to be able to get that done. And then there's just some other resources like the crisis text line, the warm line we have, the crisis line, those are resources that are available 24 hours a day and can be, people can be contacted there and they can be pointed in the right direction and get connected to the right resources too.
And that's something we can post to our Facebook.
That would be good. Yep.
And our website for free for people to review. Charlie, in line with that thinking and the work that you do and where you came from, can you also speak on what are some resources that you would recommend for people to reach out in, today's environment where social distancing is a real thing, and but also on the lines of, like Teresa said, if I'm a person who's suffering from some type of substance abuse and I want to get off of it, I've got a family, kids, house, job, whatever, there's some fear that goes along with that as well. Some courage, I think, to speak up and say, I'm struggling with this. And to Teresa's point, if I go to community services or to Dan, law enforcement, am I going to lose my kids? Am I going to lose my house? Am I going to go to jail? I don't know, maybe each one of you comment on that. Teresa kind of let it off, but and from Sheila, your perspective, if you get somebody who comes into your clinic and opens up to you about this, maybe from your perspective, walk through what somebody could expect, so it takes maybe some of that stigma, fear out of the equation. I want to start Charlie. We'll go to Charlie first, then maybe Sheila can follow up.
So one resource that is going on virtually right now is Wellness in the Woods has the virtual peer support network every day from 10 to 4. And I can add the website on there, but it gives people an opportunity to hop on, and there is a certified peer specialist that is on. Usually there's 2 people. And it gives people an opportunity to ask about resources, to check in, to kind of have some accountability without the fear of law enforcement or social services. A peer-run group, so it seems safer, I think, for people. And then with another resource, like you said, is the Warm Line. Like Teresa said, that's a really good resource for the evenings, and I'll back up and running we are practicing social distancing. So that is something that is going on at the L&O Club, where they are having meetings. So if anybody just needed help and wanted to stop in, they're very welcoming there. And I'm trying to think if I'm meeting all the questions that you asked. So just kind of the resources that are available. There's a lot of virtual meetings, but like Teresa said, that can be a barrier because if somebody's homeless, they might not have a phone or a way to charge their phone. So there are still some barriers that we're still trying to figure out. But I know for people that are struggling with homelessness right now, my understanding was the county was helping people to even get into some shelter at this time, which would give them an opportunity to maybe get more options for resources as well.
And I think I can help speak to, those of us who are mandated reporters. It's a really, I think, an important job that we're on the lookout for everybody's safety. And if I have, let's say, a pregnant mom who comes in or a dad who admits that he's, misusing a substance, if I feel like I need to report this to CPS, I don't not tell them and then go behind their back and call. If I do feel like I need to make a call, I tell them, and I love to do it with the patient in the room and tell them what I'm going to say. Have it on speakerphone because, again, you came to me for help, and my job is to surround you with those people who can support you. And so I think not having that fear that it's me against you or us against you, but saying, this is my job and it would be my job to treat or do this part of my, what I'm asked to do. And so I just want people to know that it's part of our job. But again, I like to have that conversation with you, with CPS in the room and have a plan too, because it's all about building relationships and people have either burnt them themselves or feel like nobody cares. But I mean, truly, if we treat people like humans, and I want people to see what Blade is trying to do is to see the human side and to be respectful of all of our different roles in this community.
And I think that's a good point you make, Sheila. One of the goals behind Blade is obviously to go almost in the exact opposite direction that we have been going as far as people with substance abuse and such. Obviously, we still are going to target and go after the people who are distributing our drugs because that's where it starts. But we're taking a very different approach towards this problem and trying to get the community resources available for people who reach out and collaborate. And there's all kinds of people who are part of this coalition, so there's good work happening there. Dan, from your role and your work within the drug court, can you talk about some of the things that, obviously with confidentiality, we don't want anything out there like that, but just in generalities, and what are some of the themes you're hearing as far as what are people struggling with, these last couple months, especially with COVID? It's no secret there's a lot of unrest out there for various reasons. People are struggling, and just from your work in that, can you speak on what are your experiences there?
A lot of the struggles that our members have or our participants have are no different than any of ours. They're going through the same struggles of not knowing if they're going to have a job. A lot of the people, their jobs have shut down. They're waiting when they're going to go back to work. But along with those general ones that we have, the ones that hit them the hardest is for a while their meetings were shut down. Meetings are very, very important. Some of our participants, they go a couple times a day. It's a daily thing for them. It's part of routine, and having that support in a group of people is very important. And when that's gone, that makes it very difficult. Like Charlie said, she went through with her now husband and they recovered together. That's a very good thing. And we need more people that are doing that same kind of thing, that they're doing it as a team or as a group. But when you get rid of that group setting, it really makes it difficult. The other thing is just even meeting with us is drug court. Our court hearings have been, we've been doing things virtual as well. Probation has been doing at-home visits, but they're not as personable as they can. We haven't been going out as law enforcement much to meet with our members either, and it's just all of it's making it more difficult. And just the communication things as well between their sponsors, being able to visit their sponsor if they need to. But along with all the problems that everyone's having, these are things that are shutting down, and these are the main things that are keeping people in a routine of the day-to-day, one day at a time, and just going through and recovering. And it's definitely a struggle.
And for Charlie and maybe Teresa, from the folks that you visit with in the jail setting, Charlie, starting with you, is cold turkey possible? Or is, like Dan say, the accountability or the support system better?
So it depends on the person. So when I quit cold turkey because I was so afraid to do recovery wrong, where there are tools like Sheila shared. There's tools out there. Like, those can be tools. They're not the answer, and Sheila, has shared that, it's a tool that could help somebody be a little more comfortable during a really hard time. So I've been educating myself more about Suboxone because I knew nothing of it. It was like, I just knew when I got sober, if I went in and said I was on Suboxone in a meeting, they would say, oh. Where now this is a tool. And what does this tool look like? And so can we get more education? Don't make this your forever plan, but just for today, if you're going to use Suboxone and it's going to help you, I'll support that. And so I think that's the biggest part. Like I shared, I needed meetings, I needed a sponsor, I needed accountability, I needed therapy, I needed so much more, where Brandon was just like, I'm done. That's it. And it was like, he's never looked back. And I'm like, what? How do people do that? Where I was not one of those people.
And I think Charlie brings up a good point. all of us have a different path and a different story. And like Dan said, some of the medications, people try to misuse them, and that doesn't mean they don't deserve the help. It just means what's going on in your life that maybe you can call it so desperate, where if you're needing that high, that you're taking medications that are pretty hard to misuse. And trying to do that. So it just tells me that we need to do more. And medications nothing is perfect. And like Charlie said, it's a tool. It's part of that. And a lot of times with Suboxone, we see is people are giving it to their friends or selling it because their buddy has to go to his grandma's funeral and he doesn't want to be withdrawing and he doesn't want to go there, high. And so those kind of two things. And again, we're not naive that there's not things going on. But again, if people are doing things that are like, hey, you shouldn't have been doing that. My thing is, I'm not going to beat you up and kick you out of our program and not talk to you again. I'm going to ask you why you did it. And there's usually a story behind it. And then getting Dan's perspective, because I'm not out on the streets and seeing this, but it's great if we can work together and solve where these things are coming from instead of kind of being in these little silos that I think we've been in the past and working together.
The other thing is, though, too, is we see so many people that go through either inpatient or outpatient treatment, and they do very, very well through treatment. As soon as they get out, they get back with their friends or their, just whoever they're hanging out with, or they get back in the household where their family members are addicts and they're using, and it's just the triggers that were there previous are back, and people are relapsing and going back to what they're doing before. And it's just, that's why it's very important if you can get that team setting where if you can get people to do it with you. Or there are things that it's difficult and you can't put it on, I can't put on those people, but when they have a friend that just went through treatment is trying to do this, because most people I talk to, they don't want it. They don't want to be like that. They don't want to feel like that anymore. They don't like themselves when they're high. It's the desire to feel normal when they're in that setting. But after people have gone through treatment, they meet up with these people, and it's their friends have got to respect that they've gone through that and not allow it to happen. But that's the turning point too, is it all too often someone is more than willing to give someone drugs when they've been doing so well, and we need to stop that as well.
I see Teresa's nodding in agreement. From your perspective, like Dan says, and I've been in this business for over 20 years, and you see the same people kind of go into jail, out of jail, reflock together when they get out, and it's kind of this vicious cycle that they can't seem to escape. Do you see that a lot, Teresa, when the people are talking about where they talk about, I don't know where to go or how to do this, or I want to, but.
They tell me that all the time. And just like Dan said, this isn't how they imagine their life. They didn't want to end up here. They don't want to end up at the jail with charges and everything else that goes along with that. And it's tough. And I think that there's just so many pieces to it. I mean, I think the mental health is a huge piece that can go with it. And I think there's a lot of underlying mental health components too to the substance use. And then, you throw in a lot of, some people have experienced trauma in their lives. I mean, it's just, there's a lot of healing that has to take place, and it takes time. I just think it takes time. And I do think sometimes in triggers, and a lot of people, have PTSD, and I think it's just easy to get triggered and kind of go back into those patterns again. But I do know that they're miserable when they come in, and I've talked to people that don't remember the last couple days of their life before coming in or what they've done, and it's humiliating and shaming for them, and it's really sad.
In the jail setting, Teresa, what do you think as far as the most popular drug, if you want to call it that is out there? Is it the methamphetamine, or is it something different?
It's usually meth. Yep. Meth, and we've seen more heroin though, like over the last year, I'd say, and then alcohol, obviously, and to watch people come down, like especially off it all seems terrible to withdraw from. And we have we have medical in the jail that can assist a little bit with certain medications at times to help people, but yeah, just miserable for them. But yeah, primarily meth is more than anything, I would say.
Mm-hmm. So the hard part with this too is, people always say, how does this really affect me? If people are listening to this or live in a community and things like that. And I think we've really taken a turn for the better as far as looking at substance abuse more as a disease and everything else versus just like, oh, those people, over there. Why? And can you speak, I guess what I'm trying to say is, can you speak to why do we think that this drug problem has gotten so out of control on the street level and things like that? We talk about pricing of drugs, today compared to what it was 10 years ago. There's a cost factor into it. There's a prevalence factor. It's how prevalent is it out there, Dan, that you're seeing on calls that you're on and things like that?
I guess as far as the history from 10 years plus, I guess I don't know what the cost is, but from what recent trends are from what I'm showing is that meth is cheaper. It's more available. It's everywhere. You can, it's very accessible. Even the other drugs that we're talking about, heroin, the phenols, things like that, even cocaine, if that's available quite frequently for anybody in the community to find those things.
Well, let me help.
What was the last part of that?
Let me help you out with this. Let me help you out with this, Dan. So Charlie and I go back a little ways from once upon a time. Putting you on the spot a little bit, Charlie, do you remember what, say, a gram of meth cost back in the early to mid 2000s?
For me, it didn't cost anything, unfortunately.
For the average pursuer of the drug?
I'm not even, honestly, I don't even know how to, I don't know. I would say like
$100.
$100 bucks. Yeah, I would say about $100
now,
bucks, 75 to 100.
Right. So now you're getting that same $100 worth of drugs in the year 2020 for 25 to 50 bucks. So that doesn't help our cause. Plus, the market is flooded with it and everything else. So if you're struggling with mental illness, like Teresa says, you're struggling with life stresses, you're looking to maybe turn somewhere and all that. Sheila, can you hit briefly on, prescription pills have come a long way over the last decade. We had this hydrocodone issue, Vicodin issue for quite some time, early to mid 2000s. I know the medical community is trying different things, if you will, to reduce the amount of pills being prescribed. Can you just briefly touch on that as far as that goes? Because prescription pills are a real thing. And what we see in law enforcement, especially, a lot of that is going on.
Yeah, I think we're taking ownership that a lot of it comes from, again, us prescribing. And so there's been Minnesota legislation that's been passed, and Essential Health has adopted this too, where we have a limited amount of prescriptions, and we're really looking at only treating acute pain, like a post-surgery, getting a car accident, versus using opiates as long-term pain management. And then we're also trying to look at it as if we did start you on an opioid, not to just cut you off, because I think that's what was happening to people a lot. Like, well, hey, I'm not prescribing it to anybody, so I'm not the problem. But again, we probably created the problem, but not giving people treatment after that has created more where we're looking at people using street drugs and getting, like Dan said, getting kind of creative in what they're using and how, again, because it feels terrible to withdraw and it feels terrible to have anxiety and depression. And so them treating it with whatever they can. And so, so we're working on that definitely. And, I think us partnering with law enforcement to see, because we don't necessarily see things. And it's not your 25-year-old necessarily. There have even been, people in the elderly community where I've had people getting prescriptions from a little, it's just a cute little old lady, but she was supplementing her income because she's on a fixed income. And so it's not that, people are selling too, like to make money, and it doesn't have to be, it's not necessarily the people you'd always expect either. And I think my point of that is you just can't judge a book by its cover. And that's what I like about having primary care and doing our substance use clinic here, because if we were actually seeing people in a waiting room, I don't think you'd be able to tell who was there for what. because again, we're all human and we want to get better. And like Dan said, people get out of treatment and they want to get better. And so having that step to come to us and then us being smart about our prescribing. And if we are going to take someone off, we shouldn't just cut them off, but appropriately tapering and then treating their mental health. Or do we need to send them to physical therapy? Do we need to actually relook at where their pain is coming from too? So I'm excited that we're doing some pretty awesome things at the state level and also just locally here through Essential Health and making that commitment to our patients and our community.
And I'll throw this out to anybody, but there's always this legalized marijuana argument going on in the legislature. Some states have passed various forms of legalized marijuana. Minnesota has a medical marijuana program in place that obviously has some limitations on it and such, but recreational marijuana, does anybody want to throw out there why that's a bad idea?
And I'll touch on it. I think just because something is legal doesn't mean that it's an okay thing. And I think we can look about alcohol, look at tobacco. I did my training out in Colorado where marijuana was legalized. And, I think it got passed because, we can make money off of it and taxing and that and putting that back into the schools. But really, I didn't, I saw more of a problem, and I think even some, unintentional consequences to children too in the gummy form and things like that. And so I bet people will argue this all over for medical reasons. And I don't think that it should be never for medical things, but I do think it is a drug that potentially, people are like, it's not a gateway, and I'm not calling it that, but I think a substance that alters your mind can make you make decisions that can have dangerous, you can have cravings for it and then compulsions to use it and then those consequences that are negative. So just because something is legal, again, doesn't mean to say that, it's good and that's fine. It might be legalized just simply, I think in Colorado it was mainly for a money generator.
Mm-hmm. And Dan, from your perspective, when you're dealing with somebody on the street, how many times, whether it's a DWI, an assault, a domestic, they're possessing methamphetamine, how often are guys running into marijuana on these cases?
Every time. Probably can't say every time, but pretty much anytime you're going to find a harder drug, you're going to find marijuana with it. Every single time. It's kind of a base that everybody will just kind of have. It's just a filler, I guess. It's very common. And the other thing that we're seeing though too is what's that?
Sounds like it's raining where you're at.
It's starting to.
And then Dan, a follow-up question is, what do you recommend people do? They live in a community. We all live in the community. What if I believe that my neighbor or somebody they're trafficking, they're dealing narcotics? What's something that they can do? And are you going to go out there and tell people that they are the ones who called in?
Absolutely not. If people are concerned about their neighbors or just friends, family, whoever it is that they might be dealing, you might be using, report that information to us. There's no reason why anybody's name has to be involved. If you're curious about what might be going on next door, you see a lot of vehicles going in, short-term traffic, odd times of the night, certain days of the week, whatever the case may be. If you document that, you give it to us, it's not going to get just thrown in the trash. We'll look into it. It might not be something you're going to see squad cars rolling by, but we have certain divisions for a reason that specialize in looking at these things. And if we get help from the community, it's greatly appreciated, and we don't need to have anybody's name involved whatsoever. So yeah, anytime we get those kind of tips, they get forwarded to the proper people in our agency, and it does get looked at, and we do appreciate it. So there should be no fear of retaliation.
Okay. Just these last few minutes here. Charlie, I'm just going to ask you real quick, if I'm sitting at home watching this, or I watch the recording of this later, you come from the lived experience, you have created a success story out of yourself, and there's others out there like you. Why should me, the average person, the average citizen, why should I care about somebody with substance abuse? You're on mute. Sorry, Charlie. You're muted, Charlie.
There we go. I'm somebody's daughter. I'm a mother. I'm a cousin. I'm a human. They don't know my story. And for a long time, when Andy and I met, and I'll speak on this, my house got raided. And I met Andy, and I was not a fan of Andy when I met him because I was very sick in my addiction. I had been sober for 18 months, had my child, and like Dan said, met up with some old friends to meet the baby. And when they came over to meet the baby, then then my dad came over, and I actually ended up relapsing on meth with my father. I had no intentions on relapsing that day. And so for the average person, like if maybe a loved one is struggling and you don't even know it, but you don't know somebody's story, and addiction does not discriminate, and that's the biggest piece. It's like, had someone not invested, had Kimberly not seen what was really inside of me, I would have settled for the disability they told me I needed to be on, that I was more like a 14-year-old babysitter than a mother. I would have just lived by that because that's what I was told. And then somebody came along and said, you know what, you're worth more than this, and I'm going to invest the time, and planted many seeds. And I'm so thankful that other people got to see really my authentic self, because enough people seen my using self and what that looked like. This is my authentic self. This is who I am. This is what I want to bring with my lived experience. If I help one person by sharing my story, like I said, all those hard times were worth it. Would I change anything about my story? Absolutely not. Right. Even losing my children, as hard as it was, absolutely not, because it's made me who I am today, and be able to sit and share my story and listen to other stories and build those rapport and relationships with the goal of educating. And that's what Blade is. It's helping educate. So for the average person to have the education to realize this could be your child. Me, the addict, is probably supporting your child that's struggling.
Yeah, that's a great answer, and obviously a great testimony to what you've done with your life and the hard work that you are doing. And to be honest, having met you in bad circumstances early on, and kind of see where this ironic relationship has come to with the Blade work that we're both part of, is rewarding for me, but also the group. And that, your story along with some others it will help this initiative grow even stronger. So thank you for that. Last quick comments, Sheila, Teresa, on next steps, what people could do, some resources, last minute comments, anything like that before we give it to Tammy here in a minute.
Sure, I'll just say, for anybody that wants to get a hold of us, whether it's yourself personally, a family member, a friend, if you just have questions with mental health, pre-COVID or COVID now, please reach out to us. And we have a direct cell phone number that you're going to get a hold of either myself or the nurse that we answer all during business hours, especially for our substance use clinic. And that's 218-205-0277. Because again, like Charlie said, I want to hear your story because there's something to it, and you are somebody's son or daughter. And as a faith believer, it is my job to reach out, to love, and to care, and to support you, and use the gifts I've been given by God to do that.
Very good. Teresa, any last minute comments for you?
Yeah, I would just say you're so worth it. You're worth more than your past. You're worth more than your addiction. You're worth more than mental illness. You're a human being that struggles, and just be kind to yourself. You know, I mean, there's the resources out there that I would recommend would be obviously community services. There's a lot of different resources through community services, way more than I ever knew until I was hired there. So 824-1140. You can call there. There's the crisis line, 828-4357. The text app, which is 741-741. And then that warm line, which is, I think it's, Charlie, you might know this. Is it 5 p.m. at night? Or is it until 9 a.m.? Is that what it is?
Yes, that's correct.
Okay.
5 p.m. at night till 9 a.m.
Okay, and that's 844-739-6369. And those are some places I would start.
Okay, and what we'll do is we'll gather up all those resources for people who are watching and aren't able to write it down fast enough. We will post that to our Facebook, our website later for people to get those various resources and things out there. Last thing I was going to say is on the prescription pills, there is a Take It to the Box program out there for anybody who has prescription pills that they're looking to get rid of in a safe manner. The sheriff's office has a box, Pequot Lakes Police Department, Municipal Police Department, Cross Lake Police Department, Crosby, I think I hit them all, that have Take It to the Box programs. So bring your pills there, dump them off, dispose of them safely, and keep them out of the reach of anybody who might look to get their hands on those. With that, I thank you, the panelists, and I'm going to have Tammy close us out here.
Hi, Tammy Glick. I'm Crow Wing County Community Services, Adult Services Manager. And I think one of the themes that I really heard tonight was we want to put the human in how we address this in our community. You know, substance use and misuse is often triggered by things like depression, anxiety, hopelessness, and other life events. Adding COVID to this has only, you know, added stress to people's life and feelings and emotions they may be going through right now. Blade's mission is to prevent substance misuse, and we want to protect our people, and we want to preserve the community. And we think that by having these open dialogues with our community and supporting those who are struggling with substances, we can do that. So we hope that we'll be able to do more of these, and we thank you for being a part and listening and asking us questions. And again, we thank the panelists. Make sure that you take time to click on the survey link to do a short survey to be entered to win one of our door prizes for the night. And with that, thank you again for attending.
And I think Charlie brings up a good point. All of us have a different path and a different story. And like Dan said, some of the medications, people try to misuse them, and that doesn't mean they don't deserve the help. It just means